Today, I am pleased and honored to welcome as my guest Joanne Giardini-Russell, who is the head of the Boomer Healthcare Group. Joanne, welcome to Gracefully Grading.
Thank you, Henry. Great to be here.
First of all, why don't you tell us a little bit about who you are and your background?
Oh, my background in a nutshell, I've spent 30 years coming out of Michigan State, and I went right into insurance. And nobody thinks they end up in insurance, but they do. So I've spent 30 years there. And in about 2010, I went into the financial arena, and I joined that field. Quickly learned that I don't really like that field. I actually like insurance. And a few years ago, I was introduced to the fact that I really didn't know anything about Medicare. And that was very mind-blowing to me, eye-opening, and just being in the arena of financial and professional, really just saw the niche that people aren't really doing a good job with Medicare, in my opinion. So, long story short, we end up here with my company called Boomer Health Group, and that's what we do is we help people with Medicare.
It's a great name.
Thanks, yeah, I love it. Actually, it gets a lot of traction. Seniors love it, and
Tell
talk
us
about the boomers.
A little bit about your company and how it works.
Yeah. What we do is we help people with Medicare. So I say we do Medicare. And so when people ask, well, what does that really mean? It means all the way from the assessment of, hey, I'm turning 65. Do I need to do Medicare? Should I not do Medicare? Should I stay in a group insurance plan? Should I be taking COBRA? I'm on Social Security disability at 52 years old and I have Medicare. What does that mean? So there are so many situations with Medicare that are super confusing. So what we do is we do the hand-holding. We do all of everything. We take them through the sign-up process. So we'll often sit there with a screen share. Go to ssa.gov, here's how you do that. We time it for the proper way to get off your group plan, because it's just not as easy as signing up in your window. You've got the 3 months before, 3 months after. Everyone's heard of that stuff. But when you really drill down and time it, you have to be careful with some of this stuff. So we have built this company that just works with people 65 plus generically for the most part, and we walk them through every piece. And then we are compensated by insurance carriers for putting the supplement in place. So our role for compensation is coming in and doing a Medicare Advantage product or a Medigap policy. So we really just focus on education, really, really drilling down to educating the people. We're not the people that are out there calling at 5 o'clock when somebody's turning 65, they're getting hounded by the world. We pair up with financial planners, CPAs, group health people, HR functions, and those people are typically not, in our opinion, doing a really good job with it. And fairly only because they don't live in this world, right? We live in Medicare land, we call it. And that's just, you live in there, you just start to know it. So just your attorney practice, you know what you're doing after all these years. So
hopefully. But Joanne,
hopefully.
What you mentioned,
yeah.
the magic age is 65.
Yes.
And you're saying that you have a window 3 months before, 3 months after to go into some type of plan that goes along with your Medicare. Would that be a correct statement?
That's a little, I get real technical with this stuff, like an attorney would, which is great. That's when you're technically eligible for Medicare. So when you approach 65, you've got a 3-month window before your birthday, you have the month of your birthday, and you've got 3 months after your birthday. So that just means you're eligible for Medicare. And our world sort of thinks that means you're mandatory Medicare, or you talk to friends or family and they're telling you have to, you're going to get penalized if you don't do this or that. It's not true. So there are people truly that should bypass that Medicare eligibility window because they're working and they're contributing to a health savings account. There's a lot of different reasons they might want to just let that go by. And we just tell them don't let Social Security know you exist and you're okay. So it's a little panicky on their end, but it's okay. They might need it in 2 more years. So it's not quite, we really tell people that you need to have a conversation with somebody at 64 and a half and 65 to know what you generically should be doing, right? Directionally, to get it accurate. So it's a little close, but it's very important to assess your individual situation of 65.
Now your audience is huge.
There's a few of them.
And your
Millions.
Boomer Healthcare Group, do you operate nationally? Or?
We do. We operate nationally because we can be licensed in all states. And we typically do phone work, so we're virtual. which is phenomenal. We're based, if you would say, Livingston County, Michigan, but we've got clients in Iowa and California and Florida and North Carolina. We can operate over the phone because our documents are, electronic signatures and things like that. So it's a wonderful business, if you will. There's 60 million people currently on Medicare, and those numbers are being added to 10,000 a day, are turning 65, which is exactly why you have a program like this. There's a lot of issues facing that 65 plus market, and Medicare is just one piece of that. So we really do work with other professionals too. Before the show we were talking about long-term care and custodial care and things that Medicare doesn't cover. So those are key pieces in our world that we need to then introduce the client to, just as you're doing here. So it's a big business and big giant numbers. Yes.
You raised an issue, and that is 65 is like the magic number, but also every year after there are re-ups or changes?
Open enrollment, which is coming up now. So October 15th, that our window of craziness will open, and all the headlines will start, and the phone calls and all the solicitation and agent phone calls. That's your chance every year where you can do two things. You can change Medicare Advantage plans, or you can change your drug plan. What we do a lot of our business is called Medigap, which is a different type of a contract, and that you can actually do all year long. And so we really wish people knew that, because if we're sitting here with your contract, we could say, well, Henry, we can talk about it March 13th. We don't have to wait until October. So again, it's Medicare Advantage and drug plans. So those are the only two components, but our business is absolutely insane from October 15th to December 7th. So it gets crazy, but that's okay.
What does Medicare cover? Why don't we start there, Joanne?
Yeah, Medicare, and really what is Medicare, right? Medicare
Exactly.
it's the national healthcare program for those 65 plus. It was born in 1965, as was I, so it's kind of funny. So we're both 53 years old, Medicare is. And it was really designed at the time when you think about it, they were living to 75 was, right, a mortality age. So it's changed, it's evolved, it's had issues with longevity. People are living routinely to 100. But Medicare itself is comprised of two pieces. I consider it two pieces. Some will say four. I consider it just two, A and B. You've got parts A and B of Medicare. And part A is hospitalization coverage and skilled nursing and hospice and things like that. Part A, when you get there to Medicare eligibility, it's generally free. So most people will just go sign up for it because it's free, but they just need to be careful because it does have a tie into health savings accounts that people aren't aware of. But let's just say the regular person that needs it and wants it gets Part A, and that covers that. Part B is the one that comes with a premium. So a lot of people don't understand that there's a cost to Medicare when they arrive. They've seen this Medicare piece on their paycheck, right, all those years.
Right.
And all of a sudden it adds up to, but what it is it's funding Part A. So your free Part A isn't quite so free. You pre-funded it, right?
Well, just like Social Security
Right.
isn't free, you're pre-funding that.
Exactly. So it's the same concept. And then when you get to B, then you want Part B. A lot of people think that they're just going to get free medical care, and they're not. So Part B has a cost. And the cost this year can be $134 a month all the way up to $428 a month.
How does that, what is it, based upon your income?
It's based on income. So it's a great question. It's a surcharge. It's a tax. It is based on income thresholds. So financial people. So we work with a lot of financial advisors that we speak with them and trying to get them to talk about maybe tax strategies, right? And income strategies. Because when you arrive at 65, with the onset of Medicare potentially, you don't have the ability to redo your income streams necessarily, right? So we're constantly working, educating them about that. So it's really far-reaching in what Medicare does. But generically, back to coverage, Medicare is your physician. So Part B is your doctors. It's your MRIs, it's your CAT scans, it's infusions, it's a lot of things, X-rays. So it's anything to do with doctors and services. So when you have a person has Part A and Part B together, that's 80% of their health care. So with Medicare, and we're all used to group plans where you might have a 80-20 out of pocket, right, with a financial cap. I mean, how many people are used to like your $6,000 out of pocket? That's your financial obligation for the year with your current group plan, right? That doesn't exist in Medicare. So Medicare has this 20% open piece that's unended. So you have 20% of a bill of a triple bypass is going to be a really big number. So our job as an agency and agents purely are just to come in and plug that hole. So that's where we get into, okay, then you have two choices. You have Medigap and you have Medicare Advantage. And we talk those through as to what makes sense to the person. And we put the program in place. And again, that's how we are compensated because we're an insurance agency. So it's super important that people have something in addition to A and B of Medicare. There's a fair number of people that don't have anything, and they absolutely have to have something. So depending on what route you go, we would then pair up a Part D, which is a drug plan, with a Medigap contract. So our job is just to know how to pair it up, how to make everything complete for a person. And then after they do all of those things, then they have a complete healthcare package that we do look at annually, for enhancements and changes.
So you deal with many companies, I imagine.
Yes, we do.
I mean, give us a ballpark idea of how many companies you're dealing with.
Easily 15. It could be, that we have access to probably, I think in Michigan alone, there's 40 that operate. So it makes it extra confusing. But you have your routine 10 that you're really working with. And we try really hard we don't go with the cheapest company. It's not always the best company for you. There's new companies that show up on the screens all the time. And just because somebody's new and cheap doesn't mean they're good for long term. Medicare we do reintroduce the concept of pre-existing conditions to people that are Medicare age, where our world has gotten away from that with Obamacare introduction. We're kind of people don't really remember having pre-existing condition issues anymore with insurance.
But isn't that an issue again because basically Obamacare is being gutted?
It's being gutted, but it doesn't relay and affect Medicare.
Okay.
So Medicare does have pre-existing condition problems. And so I was just talking to somebody just on the way here who has a significant health issue that I just said you need to be careful with your choice of Medicare because he has a magic 6-month window of opportunity to get it right. And we can dive into that with the technical kind of Medigap. But these people, they're just not used to that. So it's a very different world, over 65 versus under 65 healthcare. Very, very different, which is why we actually work with a lot of group health insurance people because they're often not that up on Medicare itself. So we pair up with them as well, right? So that is good. It's a good thing.
And this is where I'd like to pick up is on pre-existing conditions, which I know is a huge issue and it's something that most of us face at one time or another in life.
You're approaching 65. A lot of people have pre-existing something.
Yes.
So yeah, it's again, clearly the distinction between under 65 healthcare and over 65 healthcare is dramatically different. And we are so often, we're just used to no pre-existing conditions and just signing up for coverage. When you get to Medicare, it's extremely important to work with somebody that can time your Part B enrollment to your Medicare product. And this is where people mess up all the time. So talked to someone the other day. I'll use some real life examples. I think it kind of comes clearer to people that way. But a gentleman at 68 years old is officially retiring, and he will leave a group insurance plan. But I asked him, I said, well, good, you didn't get your Part B yet because he was working. He didn't need to go get his Part B of Medicare necessarily. Sometimes there's reason to do so, but he didn't really have a reason that he did so. But he was struggling with an illness. So in his mind, he said he just thought he was getting extra coverage with Medicare, which he is. The problem that he didn't know he had is that because he signed up for Part B 3 years ago, he went through a 6-month window where he has the ability to go buy any Medigap contract on the market without telling any agent about his health. And he has a condition that would preclude him from getting that. So now we have to use some different ways to get him coverage. You just reduce some of your chances. So when somebody's new to Part B of Medicare, they have a 6-month window of opportunity to go get any program out there. And that is just huge. So we get people years later coming to us that had no idea, A, Medigap existed, and B, they had no idea that they messed up their Part B enrollment. So you really need someone to say, okay, let's analyze all these things. Tell me about your health. What are you thinking here? What's your group plan like? What's your cost? So there's a lot to it. So it's one of those. There's of the top 3 things that people goof up in Medicare. That's one of them, definitely. So.
What are the other 2?
The other 2 are not clearly understanding the difference between Medigap and Medicare Advantage. I use, like tonight I'm doing community ed, and I hold up the handbook, the Medicare New Handbook. Look at page 5. it clearly says you have two choices of Medicare products, and people aren't taught this and educated. So what happens a lot is people get into the wrong product, and then they want to come back and they say, my gosh, I didn't know, because then all of a sudden they're starting to get sick, right? 5 years from now, there's an issue, they come back and say, I kind of remember there's good coverage. They can't have it because of that pre-existing condition problem. So we're often having to tell people, we just can't help you. So we have group Medigap contracts. We have different ways we can, like I said, 9 out of 10 times we can kind of fix things, but it's a hassle. It's a struggle. So
ideally, someone should contact you or your company.
Your advisor,
at what age?
right? Even 64 and a half. We've done a pretty good job, I think, of training advisors, CPAs, and such to start culling that database, really culling, and just doing a cursory. The way we're virtual, it's just schedule a phone consult with agent number 8, whatever. Walk through your situation. We're educator. We call ourselves on LinkedIn, it's just Medicare helpers. That's kind of how we look at ourselves. We're Medicare helpers. So get that assessment done. Call and just say, I'm working, I don't think I need to do this. Should I do this? Here's my situation. I might say, you don't need me for 3-4 more years till you retire, or something else changes. If your health changes, call me back. And we get a lot of those calls too, right? Well, I can't take it anymore, I'm retiring, or all of a sudden I'm diagnosed with something. Now I need your help. So.
Who do they talk to? I mean, do you have a whole staff? It's
oh, okay.
Definitely not you.
It's funny when you say who do they talk to?
Right.
The first thing that pops into my mind is they talk to the wrong people. So
right.
they're
no,
really
I'm thinking at Boomer Health.
Yeah, and I'll tell you that part. But the problem is when they're signing up or they're going through these things, they're talking to their neighbor, their postman, their siblings, their cousins, their guys are 65 years old. They're golfing now, talking about their Medicare plans. Right? They're not talking about so much the football game. It's interesting. So generically, people are asking the wrong people first for advice. So when we can get that across, or when they get our name, they're calling into my company, which is, we've got 5 agents right now that can service all sorts of products, Medigap, Medicare Advantage across the country. One is my daughter, so it's great. She's 23. Not many people are 23 and knowing Medicare up and down, but she does. And it's an enjoyable business, but we all, other than one person that can do some under 65 healthcare, we only do Medicare. So we've got 4 solid people that are just doing Medicare consultations. So a lot of scheduling, a lot of people just getting online, getting there. But you're going to, take 40 minutes to talk through your situation.
So, literally everything's individualized.
Yes, extremely. And it needs to be. It's totally customized. What you take is not what your neighbor takes for medication, right? They go to Walgreens, you go to CVS, you all have different doctors, you have different conditions, you have no conditions. Some want to travel, some don't care if they don't travel, right? Some are dealing with cancer and need to go to MD Anderson's, others are pretty healthy their whole life. Super, super individualized. So when we do, again, a lot of educating even to the advisors, and we're talking these stories. Your clients dealing with different things than this, so it's just the more we get that message out, it's just great for the Medicare community. It's really been great.
I mean, it sounds confusing.
Yes.
And
it is.
It's like I know someone who's about to turn 65, and she's receiving mail all the time from various companies. And I guess, for lack of a better word, Joanne, how do you sort the wheat from the chaff?
Yeah, that's the hardest part. I talked to somebody yesterday, same thing, they're turning 65. The mailers are phenomenal. I was telling a gentleman today that is turning 65 also in November that I can even have an app for my phone as an agent, and this fascinates me, but I could have an app for my phone that I could sit right here and put the GPS on, and it will tell me if I pick a 3-mile radius, it'll tell me every 65-year-old turning 65-year-old in a 3-mile radius.
Really?
Yes, his address.
I'm sure there are a lot of people.
His phone number. They're right, and their birth month. So that's how agents start, right? I've heard stories of people, walking up to the house. That happens a lot, and suddenly there's this stranger in your house signing up for Medicare stuff, products, and then they're also talking about other products, annuities and such. So it's an area where, to me, everyone knows that people need help. So there's a lot of people using the Medicare information that they have, right, to get other products introduced to somebody's world. So So like I said, the beauty of what we're doing is we're not doing that. So everything we have is just, my CPA said to call you, my financial advisor said to call you, I saw you at a seminar, and that kind of stuff. So we're fortunate in who we work with. Is wonderful clientele in referrals. So we're not having to deal with, we don't send a mailer out. We don't call you from 5 o'clock onward. We don't send information out. So you have to be discerning. A lot of that mailer is made to look official from the government, and it's not. You've seen that, right? It's Medicare, and it's not. So pretty much tell them to throw it all away. Some of those massive marketing companies are not the best companies, but they do a phenomenal job with marketing. So it's very, very difficult, actually. You have to break down the words and watch your mailing to see what percentage is Medicare Advantage versus Medigap, and it's usually like 80-20. So it's fascinating. Medicare Advantage is a big profit center for a lot of companies. So,
well, explain what the differences are.
Yeah, good time to do that. Yeah. Again, go back to the Medicare New Handbook. There's two choices to handle the 20% the Medicare is not going to cover. One way to do that is with Medigap. And what Medigap is you are enrolled in your A and B, and you add a product on top of that, which is sold by an insurance company. We do a lot of Medigap. Probably 99% of our clients are on Medigap. I do have a preference for that. It's very strong, good coverage. And they pay an insurance company $130, $140 a month for this little piece of product that will pay everything that Medicare doesn't pay for. So
isn't that critical? You think that would be a
huge. Again, some people think 20% doesn't sound like much, and it's not if it's a $1,000 bill, right? But if it's a $600,000 bill, there's going to be massive problems. So our little piece of policy here will cover that whole big old bill, even a $600,000 portion. So Medigap covers everything that Medicare won't pay for, as long as it's medically necessary. And a key component to Medigap is that you can go to any doctor that takes Medicare in the country. So you are open now to this massive network of doctors and facilities and hospitals and such that as long as they take Medicare, you can go there and be treated. That's huge for somebody that has worked your whole, you've worked your whole life, a successful practice. You've probably gotten used to saying, I want to go to this doctor.
Right. Well,
and like the choice.
Most people want to have the choice of who his or her doctor is.
Right.
So.
And as you are faced with an illness where you want good care, the best care, you want the ability to say, I want to go here. MD Anderson, for example. So if you have a Medigap policy and you want to go to MD Anderson, you go. You just go, and they will pay just like they do anywhere else. Some people will tell us they don't care about that. I don't care. I'm okay to stay in my little network. So Medicare Advantage is different in that it's a lot like your group insurance that you've had for 40 years. You have networks, right? You have co-pays. You have to call MD Anderson and say, hey, do you take my policy? And they'll say, well, you can come, but you're now out of network, and your charge is going to be $12,000, right?
How big a difference is there between the two?
In price or in price, it's great. Medicare Advantage, crazy enough, it can go from zero, literally zero, for an HMO plan up to $300 a month, a little bit over that, for a Cadillac PPO, where Medigap, and I'm just using age 65 pricing, right. But Medigap is $130, and it pays everything. So what happens is, especially when I go in front of like a CPA firm or community, like tonight, is I put up the example. If you have a knee replacement with Medigap, you go and you pay $183 because that's your small deductible. If you have a Medicare Advantage plan, you could be paying $3,000 or $4,000 because you're paying co-pays for physical therapy, hospital nights, all sorts of things. So you don't know about it until you get in that contract and you use it.
So it seems like a slam dunk that people would want Medigap. Why wouldn't they?
The only reason I've ever come up with that people don't want to pay for Medigap is we've got a couple. We've got the one person that at 65 says, I'm healthy and I'm going to stay healthy and I'm going to die at 100 in my sleep. Good luck.
Good luck.
Good luck to you. Okay.
Things happen.
Things happen. Or there's a large portion of the world that can't afford $125 a month. So truly, if they can't afford it, I would like to see them with a zero premium free plan that at least has a built-in cap of that exposure line, so that 20% isn't unopened anymore. It still is capped at maybe $5,000. So there's people that lived in subsidized. There's just that it's not a massive portion of our market, but they're out there. So the other reason, like for Medicare Advantage, veterans, folks that are VA benefits, we can give them that free product that they can go outside of the VA system. So that's a nice fit for them, or under 65 disability, which we're going to talk about.
We are out of time. Joanne Giardini-Russell, I want to thank you so much for being my guest on Gracefully Graying, and we are going to take a short break, and we're going to have you right back for the next show. I want to thank you for watching Gracefully Graying.